Starting today, if you're an unvaccinated worker in a large company, you're supposed to wear a mask to work. That's unless the court blocks enforcement. And this comes as the Supreme Court determines the Biden administration's vaccine testing rules. It focused on large employers with more than 100 workers, and another effort would implement a vaccine mandate for most healthcare workers. Our D.C. correspondent Bofta Yimam joins us live with more. Bofta, Arkansas's governor weighed in over the weekend after the Supreme Court heard oral arguments on Friday. What's Governor Hutchinson saying?
So good morning to you, Naja. Good morning to everyone at home. Governor Hutchinson is basically saying, he's pushing back a bit, reminding Arkansas businesses, or urging them, I should say, that they don't need to comply with this mandate until the Supreme Court ruling. So he's urging them to wait for the Supreme Court ruling. He also, at the same time, is calling it an oppressive vaccine mandate, as he is referring to, of course, this major rule that the Supreme Court is weighing out. He also said some employers, look, in Arkansas might make the decision to have a vaccine requirement, and he supports that. But what he's really doing, he said, really is speaking up for others who could risk losing workers. Take a listen to what else he had to say.
But others make the decision that that's not necessary. Maybe they work in a more open environment, or they have a risk of losing too many employees. And so they have that freedom. But this mandate of OSHA, the federal government, needs to be struck down, and that's why we're fighting against it. And I expect the Supreme Court hopefully to rule against the Biden administration on that oppressive vaccine mandate.
How can it be in the public interest, which is a requirement? How can it be a balance of harms in this case? Assuming the arguments aren't off the wall on the government side, and believe me, they're not. Okay, that's what I want to hear the answer to.
Justice Breyer, states can act, private businesses have acted on historic levels. This is going to cause a massive economic shift in the country, billions upon billions of non-recoverable costs. Testing also is not frequently available. This is in our appendix at page 374. Among those employers who have attempted to do so, only 28% are able to find adequate providers to ensure that weekly testing is available for the employees. If Congress intended to give an occupational health agency the power to mandate vaccines across the country, it needed to do so clearly. States can do it, businesses have done it and are able to do it. The question is not what is this country going to do about COVID, it's who gets to decide that.
I don't think as more and more mandates and more agencies come into place, it's a little hard to accept the idea that this is particularized to this thing, that it's a OSHA regulation, that it's a CMS regulation, that it's a federal contractor regulation. It seems to me that the government is trying to work across the waterfront, and it's just going agency by agency. I mean, this has been referred to, the approach, as a workaround, and I'm wondering what it is you're trying to work around.
What we're trying to do here, and what OSHA did, was rely on its express statutory authority to provide protection to America's workforce from grave dangers like this one. So I take the point and don't dispute that COVID-19 is a danger in many contexts and falls within the jurisdiction of other agencies as well. But I think to suggest that because this disease is so prevalent, because it presents such a widespread harm, somehow OSHA has less power to do anything about it with respect to
No, it's not so much that OSHA has less power. It's that the idea that this is specific to particular agencies really doesn't hold much water when you're picking them off one by one.
Now, any potential fines, the testing for employers does not kick in, Naja, until February. And again, you just heard some of the Supreme Court's oral arguments there from Friday. They have not made a decision as of this time.
Bofta, what did we learn from Friday's oral arguments? Any indication of where the court is leaning?
So look, we know that we have a conservative majority on the court, and they do seem skeptical about the broad authority of OSHA to really implement these vaccine or testing requirements for large employers. But they do seem more willing on that other mandate for most healthcare workers to be vaccinated. Again, coming into question in all of this is OSHA's broad authority here, and all eyes are on Chief Justice John Roberts, Justices Brett Kavanaugh and Amy Coney Barrett, since they have been more open to state-level vaccine requirements. The court's 3 liberal justices seem to support the employer rule as expected. They've noted that hospitals are full right now. They quoted some of the high numbers we're seeing with COVID cases. And just a reminder to our audience, the outcome will determine vaccine requirements for more than 80 million people. This is not a case that is typical, that has been brought up before the Supreme Court before, where they are deciding this level of vaccine mandates. These are things that really have not been experienced at the high court in this way in the past. When you're looking at the federal government and the big question of, look, do they have the authority to implement this? Because we know public and safety health initiatives, Naja, typically take place at the state level. And so this is bringing into question OSHA's authority, the executive branch, the federal government stepping in when it comes to health matters. Back to you.
Bofta Yimam live from Washington. Thank you for that report.